What is urinary incontinence? That is when you're unable to hold your bladder and you end up leaking urine involuntarily. There's actually two main types of urinary incontinence. There is urge incontinence, and that is when you get that gotta go right now feeling and you don't quite make it to the toilet. And then there is stress incontinence, and that is when you leak urine with physical activity or straining, such as coughing, laughing, sneezing, jumping, and even exercising. And this can happen when there's weakness in the muscle of the pelvic floor or urethral sphincter. In women, some risk factors for stress incontinence include aging, childbirth, specifically vaginal deliveries, and obesity. Men can also be at risk for stress incontinence after prostate surgery, particularly prostate removal after prostate cancer. So thankfully, there are several non-surgical and surgical options for stress incontinence, depending on severity and how much they actually bother the patient. Symptoms can be managed with lifestyle changes or physical therapy that can help strengthen the pelvic floor, but some patients may require a surgical option. For mild to moderate incontinence, that could be possibly injecting a gel into the urethral wall or even placing a synthetic mesh that acts like a sling to support the urethra. And for men that have very severe symptoms, then we can consider placing an artificial urinary sphincter. While stress incontinence is not a life-threatening issue, there are some long-term consequences that can arise if it's left untreated. It can negatively impact quality of life, where there are people that avoid social events or they'll avoid physical activity, and it can also negatively impact intimacy. If you think you have stress incontinence, please don't hesitate to come see us. Our goal as urologists to help you understand the condition and let you know all the options, but ultimately help you stay dry and confident.